Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
If you're suffering from back or neck pain, you know that it can be debilitating. On today's show, I will tackle the question of when to have an operation and when to get a second opinion. And as always, we're here to answer your questions. All that and more coming up on today's episode of Ask the Doc, No Appointments Needed. Hi and welcome to Ask the Doc, No Appointments Needed, the show where we answer your questions. I'm Dr. Georgiy Brusovanik, a minimally invasive spine surgeon, and thank you for joining us today. Let's get right to our first question. Our first question comes from Susan. Susan emailed us, I've been having sciatica pain for almost 2 years now. I've been to therapy after therapy, and it still hasn't gone away. The pain has been shooting down from my back to the bottom of my feet and on the right side. Is there anything else I can do for it? I need help badly. I sometimes can't walk and sometimes I buckle with pain. I don't want to end up in a wheelchair. Susan, you are complaining about something that I'm acutely familiar with now because I had the same symptoms. I remember being in surgery and objectively being concerned if my leg was going to buckle. I had this searing pain going down my leg. I've had pain for all of like a month before I threw in a towel. So the fact that you've been suffering for 2 years, really, my head comes off to you. I'm blown away by your toughness. So look, it's a long journey to end up in a wheelchair, but of course there's something that you can do. So the first thing that's most obvious is you need a diagnosis. Is your leg buckling because of a problem with your knee? Or is this exactly what it sounds like, sciatica due to one, max 2 discs in your lower back? So what are the steps if you were to come to my office? First, I need to examine you and make sure that we're not missing something, that it's not your hip, it's not your knee. Second, being that your symptoms are very much aligned with this form of complaint, really the most common form of complaint, then we're going to have to get an MRI. An MRI will show us the soft tissues, the discs, the nerves, and with that study, we'll be able to figure out with some likelihood which is the most likely culprit. In other words, which disc is irritating which nerve to cause these painful symptoms. Now, judging by the fact that you mentioned sciatica pain, judging by the fact that you said it goes to the bottom of your feet, it's probably going to be the very bottom disc, but probably isn't good enough. So we will need to be sure. And unless it's absolutely obvious with a single bad disc, if there's any question, then you are like most of my patients who I will ask to undergo an injection, an epidural steroid injection. These satisfy really 2 very important goals. First, an injection into the right spot may get you better and may get you to avoid needing an operation. But for the diagnostic purposes, meaning to ensure the diagnosis, a drop of medicine placed behind the disc that we propose to be the culprit, if it takes away your pain, even for a limited amount of time, that will give us the periscope into the future. That will tell us, aha, that's the disc that's causing your pain. And then, if you have an operation to correct it, you will achieve a great outcome, and there'll be no surprises. That's a really great question. Thank you for sending it, Susan. Our next question comes to us from John. John writes, Doc, I'm a 20-year-old pain management patient. I've had 2 major accidents, including one that broke 7 ribs in half in my thoracic spine. Wow, John, that's a bad accident. The second injury was to my cervical and lumbar spine. That means the neck and the back. I have been suffering debilitating pain since 2005. Wow. Over the past 20 years, I have seen 20 different orthopedic surgeons and a few that were orthopedic and neurosurgeons. Everyone has told me they cannot help me. They have been treating me with corticosteroids, epidural injections, facet injections, facet joint injections, I assume you meant, and RFAs. That means radiofrequency ablation, or a procedure to desensitize the joints from having pain, and pain meds, all of which turn out to be short-term band-aids. I know everything is masking the problem and nothing is getting to the root of them. Dr. B, please give me hope. John, I'm all about hope. Nobody wants to be in pain. So there's going to be an objective cause. A story like yours is common. It's common for me to hear. And the biggest cause of a delay in proper care is communication. The people that do your injections document the results. The people that talk to you about surgery don't often get those results, or the results aren't as specific as a surgeon might want. So if you come to my office, the pain management doctor and the surgeon, we work together. I tell the pain management doctor where I want the needle to be placed, and then I talk to the patient immediately after the operation. If the pain is gone, then we know where the pain is coming from. And if the pain comes back, if the injection doesn't last, voila, you know how to fix it. John, suffering for 20 years, I'm sorry, we have failed you as doctors, but there's always hope. There's always a cause to someone's pain. Now look, you may have a different cause in your neck and your back, and the fact that your trauma involved 7 broken ribs implies that it had tremendous energy. Energy of trauma translates to severity of degenerative changes after that trauma. So please don't despair, get proper imaging, and if your docs are not answering your question, then obviously you gotta get a second opinion. Thank you for this question, and I appreciate you sharing with us. Next one is from James, who is following along on Instagram, and he writes, after having a bulging disc on my right side in the lower lumbar, I received physical therapy and a shot. After a year and a half of pain, the other side now feels the same way, and now I have sciatica in both legs and am unable to walk for long periods. Is it time for surgery? James, inability to walk is usually consistent with what's called stenosis, or narrowing in the canal. If indeed you have narrowing in the canal, then injections may not produce a good lasting effect. So from that point of view, you may be a candidate for an operation. However, some patients present with similar symptoms just from nerve irritation. When you obtain an MRI, there is no compression. So you may have difficulty standing up straight. You may feel flexed forward like in this video, but you won't need an operation. You'll get a proper shot and get back to your normal life. So it's hard for me to tell you just from your question, but you definitely need someone who's going to listen, someone who's going to examine you, and definitely someone who will look at the MRI as opposed to just reading the report. Thank you for this question. I'm sure that this is an important question for a lot of our viewers because this is a very common problem. We just got an email from Stephen, and Stephen asks, I was moving furniture with my son into his new college apartment, and suddenly I had a week of severe leg pain. A steroid pack helped, but I don't want this to recur. What is this from, and what should I do? Stephen, that's a great question. So you could have just irritated one of your discs. If this isn't something that occurs often, if you aren't suffering from chronic back pain and leg pain or sciatica, this may just be the end of it. I would not rush into surgery or any kind of invasive procedures if you're not suffering. I hope this helps. And if your pain comes back, we can definitely reevaluate with a proper MRI. Next, we hear from Anna. Anna writes, I'm a young mom of 3 with years of neck pain and now causing headaches, shoulder blade pain, and arm finger symptoms for 6 months straight. I can't remember the last time I was pain-free. What now? Anna, a mom of 3, in terms of your threshold of pain is definitely at the top. So the weakest are guys like me, young, meaty kind of guys. A mom of one, and then a mom of two, and a mom of three, and on you go. And I hear this often. A mom will say, I don't remember the last time I was pain-free. I couldn't understand. I suffered for about a month before I opted to have my spine fixed. Really, my head comes off to you. And to all the moms out there that are suffering like this, you definitely deserve a diagnosis. Now, the fact that you have pain causing shoulder blade issues, headaches, and then you have pain going down to your arm and fingers implies extremely high likelihood that you have a degenerative or a herniated disc in the lower part of your neck. Now, I tell my patients, jokingly, you don't pay me to think, you pay me to know. So you deserve an MRI. You deserve a diagnosis. Not everyone who's suffering deserves surgery, because even patients with years of pain can just get better with a properly targeted injection. I also recommend an injection to ensure that we're blaming the right disc, so that if you inject it, pain goes away, let's say even temporarily. We will still get that feedback that we got the right spot. But with years of pain, Anna, you don't have to keep suffering. You can just correct the problem. And it's a good time to be a spine surgeon. It's a good age to be a spine surgeon, because you can be cured. You can be corrected. Let's keep it going. Our next question comes from Anthony, who is on Facebook. And he writes, I'm 80, I can't walk far, my legs feel woody and don't listen. Sitting's fine, but I can't straighten up while standing. My walking used to be okay just a few years ago. Am I too old for surgery? And what can help my quality of life? Anthony, this is a very serious question. And we don't leave serious questions up to Kentucky windage or just a gist. We need certainty. So we employ primary care doctors, cardiologists to really evaluate your health, your heart function, your lung function, and your ability to form clots. You'll get your blood evaluated. With that, we can essentially quantify the risk, and then you'll be in a better position to make that decision. Now, your symptoms are very, very clear. I can't walk, my legs feel woody and tired, and I can't stand up straight, but when I sit, I'm okay. That is classic stenosis, or narrowing of the canal. If you have that problem, the quality of life improvement with an operation is tremendous. It's literally one of the top 3 in all surgeries that are available and have evidence-based medicine behind them. Usually, when you open up stenosis in a minimally invasive fashion, patients get up from the bed, same day of surgery, stand up straight and walk. And they say that their symptoms are gone. The operation usually takes about an hour to an hour and a half, and oftentimes it really feels like a miracle. Patients will come in a wheelchair, and then they will just walk. Now, you may find, since you haven't walked in a while, that after you get your legs back to listening to you, you hit another ceiling because you're going to be out of shape. So give yourself some time to get back to normal. Injections aren't great with stenosis. It's still worth to try, but studies show that injections with a static nerve compression, as what happens with stenosis, injections don't seem to last. Therapy doesn't really help. Massage doesn't really help. This is an electrical problem, and it's totally correctable. Your age should not be the scary factor. It's all the other stuff. It's your general health. Definitely don't lose hope. You have a lot of life, and there's no reason to spend that time in a chair. Our next question comes to us from Tyler. Tyler asks, I have constant daily headaches, front and back, neck pain, whole body aches, and I've been losing weight without trying. I'm really concerned. What is that from, and what should I do? Tyler, you need a diagnosis. Anytime that a doctor hears that there's weight loss without trying, that's a big red flag. Now, I'm not saying you have anything scary, but you deserve a proper evaluation, blood work, your chest exam, abdominal exam. In fact, these patients who have complaints of unwanted weight loss should really be treated like an emergency and evaluated quickly. I want to give you hope, and the reality is that if you get a diagnosis, you can jump on it and correct it. And most things are correctable, but you're going to have to make a quick move and figure out what's going on with the help of docs that are going to listen and who are going to care. Do it. Do it ASAP, Tyler. The next email comes from Ben, who writes, I'm 35 with mid-back pain under my shoulder blade, neck stiffness, and occasional arm pain. An MRI showed nothing, and the doctors suggested meds only. What else can I do? Ben, our show is entitled Surgery versus a Second Opinion. You need a second opinion. I strongly believe that no one wants to be in pain. If you are in pain, there's a cause. So the symptoms that you are presenting with, mid-back pain, shoulder blade pain, and neck stiffness, are usually related to a disc in the lower part of your neck. Occasional arm pain further supports the diagnosis. But the fact that an MRI showed nothing means very little. Many patients come to my office with the story that the MRI showed nothing. Look, honest truth, many times, I believe that many times the doctors may go by the report and not look at the pictures. In fact, even radiologists, who are doctors that look at the imaging, will miss narrowing of the channels where the nerve exits the spine. Now, if you miss that, and it's not to a fault of these docs, these channels are at a 30-degree angle with the typical planes that are presented in an MRI. So it's easy to miss. If your doc is not scrutinizing the pictures, him or herself, they may miss it. So get a second opinion. And this is a perfect example of a person that deserves a second opinion, because I stress this, everyone who is suffering has a reason for that. No one wants to be in pain, and you deserve a diagnosis. You deserve to be better. Thank you for this question. And I hope, Ben, I really hope that this question, my answer, gives a lot of our listeners some serious hope. Okay, our next email comes from Angie. Angie writes, mid-back pain has been waking me up at night for 6 months. I've lost weight. Recently, I coughed hard, vomited, and saw blood. What should I do, doc? Angie, the fact that you vomited and saw blood must have been very scary, and I'm sorry for that. Now, it doesn't necessarily mean something bad, because look, you could cough really hard, pop a vessel in your esophagus, and then get really freaked out because you will see blood in what comes out. Now, that being said, you definitely need a diagnosis. The things you are describing can be attributed to a disc in your neck, because mid-back pain, especially pain around the shoulder blade or the area where in a woman the horizontal bra strap kind of crosses, that area actually gets pain referred from a lower part of your neck, from the C6-7 or C7-T1 disc, the very last disc in your neck. So the fact that this pain has been waking you up is less scary, but still a reason to get a diagnosis. Now, if you were to come to my office, I would get some proper blood work. I would also obtain a CAT scan of your chest, abdomen, and pelvis. Now, don't get freaked out, but we do these studies to catch cancer, and we don't want to toy with any possibility of cancer. We don't want to leave it to chance, and we want to get at the diagnosis right away. So I would get a neck MRI, because that's the most likely study to produce a diagnosis, but I would get some of these other studies in order to make sure that it's nothing bad. Angie, you need a second opinion and not any kind of operation. Don't rush into surgery. Thank you for this question. All right. The next question comes to us from Jerry. Jerry writes, I'm a 28-year-old guy, healthy and active. I've had back pain under my shoulder blade that radiates into my triceps and pinky. It's worse with sitting and turning my head. PT and stretching haven't helped. What else can I try? Jerry, the fact that you're 28 years old means that the possibility of cancer, of all these scary things, is very, very low. Back pain under the shoulder blade tells me that you probably have something in your neck, either the C6-7 or the C7-T1 discs, because those two discs will frequently refer pain to the bottom of the shoulder blade. If the pain is at the very top of the shoulder blade, then it's most likely coming from the C5-6 disc. So to address that, you'd need an MRI. Then you wrote that pain radiates to your triceps and your pinky. Now, look, I'm not going to overcomplicate this, but this is an important point. Pain going into your triceps is most likely in the distribution of the 8th nerve. Now remember, nerves come from your brain, they go through the spine and then out into the extremities. So if that nerve is irritated in your neck, you'll have pain in whichever direction that nerve travels. So triceps and pinky is usually the 8th nerve, which would be irritated by the, again, C6-7 or the C7-T1 disc. Again, that points at a problem in your neck. The fact that it's worse with sitting and turning your head further supports that the problem is coming from your neck. But could you have two problems explaining your issues? And specifically, I'm referring to the pain that goes to your pinky. Now, pain going to your pinky is something that may come from your elbow. A lot of us find that you wake up at night with severe elbow pain, pain that feels like numbing or tingling, and it keeps you up at night. Then during the day, there's a lot of elbow pain. So is it possible that you have two common problems? Compression of a nerve behind the funny bone in your elbow, as well as a problem in your neck. Now, look, there are a few ways to differentiate this. And a common thing I hear is that patients get sent for what's called a nerve conduction study. Now, this is a terrible study. You get little needles, like acupuncture-style needles, put into your arm, and then electricity gets sent through those needles. And then we get to study the strength of the signal. It sounds terrible, and it is terrible. And the worst part is that unless you have constant symptoms, like constant numbness or even weakness, there's a very high chance that the study will be falsely negative. So you'll go through this brutal study, you'll come back to your doc, and there'll be no additional information. So how do you differentiate this? And I have to give the credit where it's due to my old chairman at Duke. He would tell patients to take a towel, big, thick towel, like a bath towel, wrap it around your elbow, and then put tape over the towel. Now, if overnight, sleeping like this, you hyperflex your arm, then the towel will prevent you from doing that. Hyperflexion will irritate the elbow. And if the towel prevents that and your pain is better, then we'll know that there are actually two issues. Triceps pain, shoulder blade pain coming from your neck, and then the pinky pain coming from your elbow. You can go to pillowforpain.com. That's a website where a brace is sold that actually helps with this exact problem. But I don't mean to advertise that website. What I want to tell you is that above all else, like all these previous patients, you need a diagnosis before you embark on any surgical procedure. And definitely try something conservative, like an injection, before rushing into surgery. Thank you for all these wonderful questions. And I hope to hear more on our next episode of Ask the Doc, No Appointments Needed.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.